My name is Jennifer Molina and I'm a full spectrum doula. Doulas provide advice, information, emotional support, and physical comfort to a birthing person before, during, and after birth. In my practice, I help patients understand what's happening to their body as it relates to prenatal, pregnancy, birth, postpartum, abortion, and pregnancy loss. So, you're thinking about having a water birth. Here are some things you may want to know. A water birth means that a person gives birth in a body of warm water, usually in a tub. And some people choose to go through their labor in water before giving birth on a bed, since water during labor acts as a natural epidural. Once you are submerged in the water, your body releases happy hormones like oxytocin, which make you feel relaxed and helps to regulate the intensity of contractions. Water births are also welcomed by birth givers because it naturally relaxes the perineum, which can reduce tearing. It is a very personal decision. However, speak to your midwife or OB first to see if you are a good candidate for a water birth. Those with group B strep positive cultures, gestational diabetes, preeclampsia, macrosomia, intrauterine growth restriction, prematurity, and unproven pelvis or other conditions that put you in the high-risk pregnancy category may be advised to opt out of this kind of birth, since it is easier to monitor those conditions outside of the water. Also, during a water birth, there are risks such as infection, meconium, aspiration, which is when a baby inhales contaminated amniotic fluid from its first bowel movement, pneumonia, tearing, drowning, and also tearing of the umbilical cord. These risks all exist even if you are not having a water birth. To help avoid risks, you have the option to have a water birth at a birthing center or even at a hospital, depending on what birthing options are available in your area. And if you're planning a water birth in a hospital, always ask when was the last time someone had a water birth in their facility, and also ask your provider what their thoughts are. Many hospitals have the facilities for water birth, but may not allow folks to use them. If you decide to give birth at home, you can rent or buy your own birthing tub. Many midwives have one that you can borrow or know where you can get one. Water births are generally less expensive and also have fewer interventions often seen in a hospital. And some water births are even covered by insurance, if you have it. But you want to check if an at-home birth is covered too. Most people are able to get reimbursed for some, if not all, of their water birth experience. Remember, there's no right way to give birth to your baby. Do your research and then decide what is best for you and your birth journey.